My name is Dr. Oris Kremniski, and today we're here with Brian Smith, a patient who recently has completed his dental implant therapy. Brian, can you tell us a little bit about what motivated you to start looking to get dental implants, and what's the process that you went through in finding a dental implant therapy office?
Okay. I originally had dentures, and they were not a good fit for me. I don't know if I had a bad denturist or it's just the nature of dentures. I didn't have any bite capacity. I ate most of my meals with my teeth out, actually. I found food that I could eat without teeth. And that went on for a couple of years. And we researched it more, and we realized that I would start losing bone in my mouth, and I'd have to have my dentures redone. And so we said, okay, we've got a little money now. Let's look into a permanent way to fix my teeth.
Brian, can you tell us about the experience in our office and the process that you went through when you first came in for your initial consultation?
First of all, I chose 3 periodontists to look into. Ivy, my wife, and I did. And when we came into your office, yourself and Michelle were great. You explained the process to us. We sat down and we discussed the options as far as, we actually discussed them in several ways. We discussed them as far as what would be the best option for me, what would be the most economical for me, and you let me make that choice. You didn't push me. We had no idea what we were doing, so you took a lot of time with us, and you let us make our decision. You didn't push us.
Brian, when you first came in, I know you thought that we were going to do all the treatment here in our office. Can you tell us a little bit more about that?
Yeah, you explained that what you do are the implants which actually secure the dentures. And what you did is you sent me to experienced denturist or dentist, and between the two of you, you work miracles. You work like a single office. I mean, it didn't feel like I was in 2 offices. You guys were in cohesion, and it went well.
Can you tell us a little bit about the concerns you had regarding treatment here in our office?
Sure, my biggest concern was pain. The thought of having implants drilled into your jawbone is not comforting. But really, there wasn't much pain. The lower jaw had a little more than the upper jaw.
What was the treatment experience you had here in our office?
Initially, I had a lot of anxiety over pain and the unknown. But you explained to me what you were going to do, and you gave me medication that dealt with the pain, and you even gave me medication that dealt with my anxiety. So what I thought was going to be a miserable experience turned out to be hardly really anything at all. I mean, I'd had root canals that were worse than what I went through with you, and you put 9 implants in my mouth in one day. So I was pleased with the process.
Brian, can you tell us a little bit about how the quality of your life has changed since you've had the dental implant therapy completed?
Oh my gosh, I don't know where to begin. Number one, I can smile. I never smiled before I had my implants. My teeth were terrible. I can eat anything I want now. When I had the dentures, I was very limited as to what I could eat, and now I don't even think about what I'm eating. The implants are actually easier to take care of than regular teeth. I mean, the flossing, the brushing, it's just an easier maintenance program than regular teeth. I'm not suggesting having your teeth pulled and having implants pulled in if they're good, but there were so many benefits to it. And I don't even feel like I have implants anymore. They just feel like teeth. I would recommend you to anybody, Dr. K. My stepdaughter is having some implants put in your office right now. We referred you to someone that my wife works with, and he plans on coming and meeting with you after the first of the year. I can honestly say anybody who is unhappy with their teeth, who wants to do something about it, do it, because you changed my life, and I can't thank you enough for that.
Brian, thank you very much. I really appreciate you coming down and sitting down with us today and telling us your story.
It's an honor.
It's been a pleasure treating you, and we look forward to seeing you in the future. It's just coming in and saying hello.
I will.
Thank you.